here are the cranial nerves. We'll go through them really quickly. There are 12 cranial nerves. This is the sensory input nerves to the head. So almost all of your really important sensory organs go directly into the brain. So the first one is the olfactory bulb, which is for smell. The second one is the optic, which is for vision. The next two are also involved. They're actually the ones that control your eye movements. So the next is the ocular motor, which controls the eye, the eyelid, and the pupil reflexes. The trochlear is a muscle that actually controls eye movement. And then the trigeminal, that tri meaning three, it's actually three nerves that come in and innervate the face. And that's because your facial touch and jaw movement controls a lot of that. You guys heard of like trigeminal neuropathies. These are really bad, where people feel like their nerves are, their face is on fire because the trigeminal nerve just starts firing like crazy. Have you heard of Bell's palsy? It's sometimes a bacterial infection that comes in, and then people get totally, that will be either the trigeminal or the facial. So there's facial, and they'll get an infection which blocks the trigeminal or facial. Abducens is another muscle that controls eye movement. Facial, that does most of your facial stuff for creating expressions and taste. There's the auditory vestibular, so everything coming from the cochlea and all of your vestibulars for figuring out your orientation of your head in space, going through that nerve. The cochlear implants are all about restoring input to the auditory vestibular. This is the 8th nerve, often just called the 8th nerve. The glossal pharyngeal, which is going in, this is the 9th. It's going in and innervating your throat and the salivary glands, and it also controls the blood pressure. The auditory nerve and the glossopharyngeal are fairly close, so it's known in old people and in geriatric hospitals that if you're cleaning out somebody's ears, it actually can cause the blood pressure to drop and the person to pass out. So you have to be careful by sort of cross-activation of the head and controlling something like blood pressure. Seemed like it would be a bad. The vagus, I just found out, comes from Vegas, the star, which is called the Wanderer, because it sort of moves around. Vagus actually is a nerve that sort of goes throughout the body and does a lot of things. So it controls the parasympathetic system, controls the lungs and abdominal organs, and a lot of your pain pathways in your body, so not on the skin, are coming in through the vagus pathway and some throat movement. And then this is, I think, the 11th, the spinal accessory, so throat and neck movement. And the last is the hypoglossal, which is tongue. So I want you to be able to memorize this long enough to go through an exam. So you're going to have to just go through these, and there are lots of mnemonics. This is my least favorite, but most popular, is called On Old Olympus, Towering Tops, a Finn and German viewed some hops. My favorite one, if I repeat it ever again, I may not ever get tenure. So there is whole lists of mnemonics on Wikipedia. I guarantee you there are much more memorable ones, but I'm not allowed to use them. So here's a typical pathway. Here's the trigeminal nerve, which is innervating your face. And then it goes into the brainstem to the trigeminal nucleus, and then projects up through some thalamic nerve, thalamic region, and then projects to your sensory motor cortex at the appropriate level of something for your face. Just a brief mention of the vasculature. So a lot of functions, a lot of loss of function in the brain is caused by strokes, and there are large regions of the brain which are all vascularized by one big projection. So by knowing where these are, you can make sense of, hey, well, it would make sense that these stroke of this blocking this particular blood vessel at this particular junction here would cause executive function loss as well as motor pathway, whereas another one, where it might preserve the sensory because it's being supplied by blood from other areas. So there's lots of different blood vessels. I'm not going to ask you to memorize them, but I wanted to mention them. So the carotid is the main one coming up to the brain. There's sort of two big vessel source. This is the carotid is one, and then the ventricle arteries. These are the ones coming up along the spinal cord. These all come up and feed into one huge ring here. This ring is called the circle of Willis. So if you actually get a blockage here, blood that would have normally come through can't go through, but this one will actually cross over through the anterior communicating artery and then resupply blood going up to the other side. So there's a little bit of redundancy in the pathway through the circle of Willis. And then you have different blood vessels that go off and innervate or provide blood to the cerebellum and the occipital cortex and parietal cortex and things like that. There were lots of sort of names for like big groupings of different. One of the most famous ones called the Papez circuit. It's the emotional brain circuit, so it involves the hippocampus and the. But so there's sort of names for these. You'll hear them used at times. I don't use them terribly often.